Parkinson's disease is a progressive neurodegenerative condition.
Dr. Michael Guskowski is a neurologist and movement disorder specialist at Cleveland Clinic.
The most obvious symptoms are slowness of movement and stiffness of the muscles. Over time, patients most commonly get a difficulty with tremor and stiffness with just doing basic activities and a slowness. So they may have difficulty with moving, handwriting becomes smaller, walking can become more difficult over time.
So they just have to hit that target.
Right.
Do they get feedback?
They'll get a sound.
Guskowski and his team have started a gait clinic to help patients with Parkinson's.
The Gait and Balance Clinic that we started last year is a multidisciplinary clinic that we created for patients with Parkinson's disease and also with Parkinsonism. The goal is for patients with a lot of complex walking and balance issue to be seen in this multidisciplinary clinic.
Amy Chan is a clinical specialist physical therapist working with Parkinson's patients.
The clinic involves Dr. Guskowski, who is our movement disorder neurologist. I am the physical therapist who specializes in neurology. We also have a nurse practitioner who is from our physical medicine and rehab team, who actually go through a detailed gait assessment, walking assessment with a machine called a gait right. So give us a really detailed measure of what their walking speed is like, what their step is like. We have equipment like specialized treadmill that can help them with walking training and balance training. Once we get a chance to establish their care in the gait clinic, one of the big goals is to find out what type of follow-up care they will need. So for example, if I see a patient in the gait clinic and they can benefit from further physical therapy, so they will come in for more standard of care, traditional therapy. Usually they come in once or twice a week, okay, and for about a month, and then we'll reassess to see what their needs are after that.
Many of these patients have not one issue, but they have many issues. So it's not just Parkinson's, but they may have, arthritis in the low back that causes pain. They may have a severe peripheral neuropathy. The other concern that the patients may have is something called normal pressure hydrocephalus, which is a condition where spinal fluid backs up in the brain and they have difficulty with walking. And sometimes that gets missed, and something that really shouldn't be missed. So it's something that we look at very closely.
For Fox 8, I'm Dr. Mark.
Dr. Mark is sponsored by the Cleveland Clinic.